So informative. Wow. So we're moving along quickly, and the next presenter will share on exercising your rights in the public health system. And we have Dr. Althea Bailey to share with us. She's a lecturer in the Department of Community Health and Psychiatry at the University of the West Indies Mona campus. For over 30 years, she has specialized her research, teaching, and service in the area of health promotion and behavior change communication. In addition, she has a strong focus in the areas of HIV prevention and reproductive health at various levels within the public health system, as well as NGO and at the community level. So please make welcome Dr. Althea Bailey.
Okay, good afternoon, everybody. First of all, I'd like to say thanks so much for inviting me to this session. I actually feel guilty. I should be paying. I've gained so much information in the little time that I've been here, which I'm very, very grateful for. I'm somebody who's worked, as you heard, in the health system for a very long time. But actually at this session, I've learned a lot of stuff that I didn't know before in terms of managing sickle cell disease. I'm going to be very quick. I don't know how to find my presentation. It's called Patient Rights. And what I'm really going to talk about is not so much related to the managing of sickle cell disease, but it's more in seeking healthcare in the regular health system. I know that when you go to your your treatment center, you don't have many challenges. However, very often you have to seek care in the public health system. And you know, everyone who works in the public health system is nice and friendly. And I hear a, okay, so I'm hearing it here too, unfortunately. All right, so I'm going to talk about patient rights. I'm going to describe the Jamaican public health system, just quickly, for those of us who are not very familiar with how it works. Describe patient rights mechanism that exists in the public health system. Yes, there are patients' rights in the public health system, believe it or not, and recommend what you can do individually, but also as an advocacy group to improve your patient rights. So patient rights is not something that is given because you feel like giving it. There are actual legal and ethical things that our government has signed to say that Jamaican people who access care are entitled to these rights. And it is in the basic one. There are a lot of them, but the one that I thought that absolutely they signed the Universal Declaration of Human Rights, and it's a long time ago, okay? And it says that you have the right to privacy and confidentiality. You have the right to quality medical care without prejudice. And as you heard in the introduction, I have worked mainly in HIV prevention, and a lot of people with HIV do not experience the without prejudice because people assume a lot of things about them, and there's a lot of stigma. And there is some stigma related to having sickle cell disease as well. So you're not unfamiliar with the stigma. So you're entitled to quality medical care without the prejudice. You have the right to make an informed decision about your treatment options. You have a say, not because it is free healthcare, but you have a say in what is done, and you have the right to refuse treatment. All right? So that's making that clear. So talking about the Jamaican public health system, in Jamaica, the government's policy is free healthcare, which means that if you access care in any public health facility, there is not a charge to you, the user. Of course, nothing in life is free. So a lot of people think that there's some philosophy about that. Some people think that in the days when we used to pay something, because we have never ever paid the full cost of healthcare in the public system. In the days when you were asked to make a contribution, that the quality of the care was better, and some people argue that yes, you need to have free healthcare because there are people in Jamaica who can afford nothing at all. All right, so that debate is still going on. However, we do know, those of us who work in the public health system, well, I no longer work, but when I used to work in the public health system, when people did not have the fee, all right, people were not turned away. That is my experience. People say that's not true, but I know, having worked in a public health facility, if somebody came and they did not have the fee, they were not turned away. Okay? So, what is the Jamaica public health system? Of course, you know all the hospitals. Okay? Not the private hospitals, the public hospitals. Incidentally, University Hospital of the West Indies is not one of those where you don't pay fees. So a lot of people don't understand that. University Hospital of the West Indies is not one of the hospitals where there's no user fees, because it is not fully covered by the government for all its costs. They do get a subvention. But then you have other public, you have 25 hospitals that are across Jamaica, all right? And of course, you have 317 health centers island-wide that provide primary healthcare facilities. These are the preventive health centers where you go to get your immunization, all your different screenings and so on. They do have curative, some amount of curative care, but the design of those services is to prevent you. You just heard the presentation from Dr. Simmons Brooks about wellness. And that is what it is designed to do, to keep you well. Now, the health system, the Ministry of Health is really responsible for policy, making policy, okay? And then you have what is called regional health authorities. And there are 4 regional health authorities in Jamaica, as you can see on the slide here. The Southeast Regional Health Authority, it's not pointing, all right, is Kingston, St. Andrew, St. Catherine, and St. Thomas. All right, that's the largest region in terms of population size, but you can imagine half of Jamaica lives in that region. Then you have the Southern Regional Health Authorities, Clarendon, Manchester, and St. Elizabeth. Then you have the Northeast region, which is St. Anne, St. Mary, and Portland, and the Western region, St. James, Westmoreland, Trelawney, and Hanover. And each regional health authority gets what they call a service level agreement from the Ministry of Health to implement the health care, and they are responsible for running the hospitals and running the health centers. So these, the Ministry of Health doesn't really have what is referred to as a patient's right charter. However, all right, in their strategic business plan, which just ended recently, and of course they have a new national strategic plan now, where they do have a patient charter, but it says that people are entitled to customer service, that all Jamaicans are entitled to customer service, and that implies patient rights. So the regional health authorities, references on all their websites, if you go, you Google Regional Health Authority, whatever, you will see they have a customer service charter. And the customer service charter states, and I'm going to share a couple of them with you, what to expect when you use one of our facilities. This is what we say we are going to give you. And of course, they also have dedicated telephone lines and email addresses for customers to register a complaint. So if you go to a health facility, all right, whether it's a hospital or a health center, and you did not get the kind of care that you expected, or you were treated rudely, even at the level of the security officer, these are there that you can call, and they are supposed to display that in every health center so that you can get the number for that region where you can lodge your complaints. And in working in HIV, I have done this for many, many times for people with HIV who have experienced poor customer service. So the Southern Regional one, this is one I'm sharing with you. Listen to it and what it says. To enable the health and well-being of residents of those parishes by providing access to quality health care through a suitable and responsive healthcare delivery system that is family centers, customer focused, and stakeholder driven. So what they're saying is this is what we guarantee you. I know people are sitting in there being polite and you're not groaning like the students, and you're saying, huh? Which part? That exists? Anything like that happen? But that's what they guarantee you. So if you don't get that, you have the right to complain. You have the right to access. You can access the services, all right, that address your healthcare need. You have the right to safety, all right? You must receive safe and high quality healthcare services, all right? Respect. Oh, good, you guys are not shouting at me. All right, you means I can expect care providers to respect me, my culture, my beliefs, my values, and my personal characteristics. So whatever it is, whether I'm Rastafarian, Muslim, I'm supposed to get respect. Communication, I have the right to be informed about services and treatment options in a clear way. So no technical language that I don't have a clue what the doctor or the nurse is saying. You can say, Doc, I do not understand what you just said. Could you explain to me simply? You have the right to ask for that. Nurse, I don't know what you mean. Could you explain to me simply? You have that right. That's what they're saying, they're guaranteeing to you. All right? So it must be given in a timely way, in an appropriate communication, including Jamaican English. Well, I don't want to call it patois. All right. It also says I'm entitled to participation. Remember, the Declaration of Human Rights says you have the right to choose, right, whatever it is they recommend for them to, they recommend that you should, the treatment that you should get. Okay? So it means that you have the option to join in the decision making and choices about your care and about which services you access. You have the right to privacy and confidentiality regarding your personal information. It means, all right, that they should maintain proper handling of your dockets, your personal health records, and any information related to you. I am not going to be a hypocrite. I am going to say that this is the main breach in providing in our health services, unfortunately, confidentiality. And unfortunately, although most of us who work in the healthcare are professionals, and I'm not going to blame, and when we go to the professional groups and we say, this is a charter, this is what you're supposed to do, we say, oh, is the security, is the so-and-so, the ancillary staff. But we do have complaints from patients where nurses and doctors do not respect patient confidentiality. So we are aware that it happens, okay? You also have the right to comment. And very often people say the doctor doesn't want me to say anything. You do have the right to comment about your care and to express your concerns about that care, okay? So it means that you can complain about something, all right, that the doctor insists that you should do, and have your concerns dealt with. So you shouldn't be dismissed when you complain about something. Of course, you also have a responsibility. Right. You have the responsibility to also be polite. Let me try this one. All right, you also have the responsibility to be polite. You also have the responsibility to treat the healthcare provider with respect, and respect gains respect. So I'm not saying you have rights, but you don't have any responsibility. All right, so the good news is that, as I said, they have a new strategic plan, and in that strategic plan, All right, they speak about compassionate care. All right, and there is currently something in front of cabinet. All right, a document. All right, a draft patient charter that is to be passed, and we know how our governments stay. It can be what is called a green paper, and that green paper can be there. For example, our Occupational Health and Safety Act of Jamaica has been a green paper for 20 years. I'm not discouraging you. I think that this one will move faster, but it is at that level where you can now have the right to sue the government if you don't get the care. So it's a draft patient charter, all right? And the terms of references of the boards of the hospitals that you go to, part of that is in their terms of reference, that they are to guarantee the standards that they put on that website. That is part of the terms of reference of the board. Unfortunately though, and I know because I have had to do it, Jamaican people don't like to document. They don't like to write down nothing. You cannot take a complaint to the board of a hospital if it is not in writing. So I have to sit very often, as I said, I work with patients with HIV, and actually write the letter for them and get them to sign it. But you have to document what happened in a coherent way so that it can go before that board and that the person can be disciplined, or you can get whatever it is that you are entitled to because something went wrong. There is a patient complaint document, and I said if you're not good at writing and you don't have anybody to help you to write the letter, call the numbers. All right, call the numbers that are in the health centers. They are supposed to display those numbers. And of course, it is in the new strategic plan, as I said, that you're entitled to. So, what can you do to make sure that you get the service that their customer service charter says you're to get? I think that one of the things that we are not very good at in Jamaica, and it's one of the things that I'm in an organization called PROMAC, that they're trying to improve patient rights. And one of the things that I am working on is to have patient advocates for every kind of condition. You should have a patient advocate. People who are trained in advocacy, who are coming from the perspective of the patient. So at every health facility, you should be able to go and find someone or be accompanied with someone who is a patient advocate. Because some of us are timid in personality. We won't stand up for our rights. Some of us feel intimidated because we can't speak the Queen's English and different. So we need patient advocates. Perhaps the Sickle Cell Disease may want to train some patient advocates. We want to have a reporting and redress system. You can either use the one that the ministry has, or you can push for one for patients with sickle cell. The people with HIV have developed one for people with HIV, and they have asked the ombudsman, which is now a woman, all right, she's a lawyer, and she is the person who brings their cases. So you can also go to some representative at that high level. They have a reporting and redress system where somebody documents the things that happen in the facility and they take it to the ombudsman who takes it. Because many of us can't afford a lawyer to sue the government. We have to teach patients assertion skills. You have to be assertive. You have to without being impolite, without being rude, without hitting anyone, without cursing anyone, let them know this is what your charter says, and I am supposed to be able to do this. I can ask questions, I can comment. You have to learn those skills, and you do that through support groups. And we have done that with patients in HIV. We have support groups, and people stand up for their rights. You get a lot of bad treatment, and I know that a lot of women who are sicklers who decide to have a child, there is a lot of stigma related to that, and it's the same thing with HIV. So, somebody you can have to be your own advocate. You have to speak up for your right. It's your decision. People shouldn't treat you bad because you made a decision. all right? And facilitate patient empowerment and responsibility through support and advocacy groups. If you're already a part of that, part of what you should do is do your role plays, learn how to be assertive when you go to the facility, okay? And of course, educate yourself, understand your disease, be able to say what is it you need. There was a video going around about a year ago of a patient who was admitted on a ward, and she was asked, I don't know how many of you saw it, she was somebody with sickle cell disease, and she was asking the nurse to call her doctor because she was in intense pain and she wanted a change in the medication. And did anybody see that video? Right, and you saw the nurse's response. She totally ignored the woman, and she was trying to intimate that the person was a drug addict and just wanted the medication for the medication's sake. And this was a real thing that somebody videotaped, okay? And this is something that we brought to the minister's attention. Although it wasn't HIV, we brought it to the minister's attention. We said, this is not even HIV, and look how the nurse is treating. She didn't even look in the patient's direction. She sat there and she didn't even look in the patient's direction. We know that there are good, lovely nurses, but unfortunately there are some who behave that way. And of course, one of the issues is that a lot of healthcare providers, unfortunately, are not sensitized to the needs of people who are living with a condition. They're not sensitized. Yes, they went to medical school or whatever training they got, but they are either become so hardened or they don't really understand the psychosocial issues. They treat the disease and not the patient. You see what I'm saying? I teach medical students and I keep saying to them, you can't focus only on the disease, you have to look at the patient. Who is this person? What is their educational level? What is their background? What kind of work do they do? What kind of family support do they have? You have to know these things. So we need, as part of what we still do, not so much now, but earlier when people didn't even want to touch a patient with HIV, is we sensitize people to understand that people with HIV are not all homosexuals, and even if I'm a homosexual, I still am entitled, based on your Human Rights Declaration, to all the services in the manner in which you would treat anybody else. So we had to go and sensitize healthcare workers and so on. And this is something you can do as a group so that they can better understand what it is you're living with on a daily basis, because trust me, a lot of them do not know, do not assume that they know, and when they know, they will probably have a better attitude. So that's basically it for me. Jamaican people think that the only way you get your rights and your justice is going out in the road, blocking it and putting up a placard, we want justice. And you can do that, but the information that I've shared with you, use it, learn to be assertive, work on your advocacy groups, sensitize the healthcare providers, and we can make a difference. But also, as an organization, join with the other organizations who are saying, this guarantee that the government is giving us by making this declaration, the Patient Rights Charter, a legal document, do not sit on it in Parliament for the next 20 years, please. We need to be a part of that group to say, we need to get it now, we need it next year. Don't vote for, we're not voting for you until we get it. Because that's the only thing politicians listen to, they vote. All right, thank you very much for listening.